I want to begin to address the actual neurobiology of emesis and nausea, and I'm going to divide this up into different sections. The first thing I want to do is focus in on how the peripheral system communicates to the brainstem, which of course is going to be involved in emesis and nausea. And then the next couple of lectures, I'm going to actually get into the brainstem itself to go through the various interactions of areas of the brainstem in terms of emesis and nausea. So this lecture here, I'm going to focus on periphery. So we're just going to basically talk about the brainstem as just a little box here. And so I've got the cartoon here, so that's going to be our brainstem there. And then also the little line drawn below it, that's going to be spinal cord. I'm just going to go SC for spinal cord. And I've drawn in a little lung and drawn in a heart because that's going to be important as well. So there are basically three ways by which information is communicated to the central nervous system relative to emesis and nausea. And one is going to be the peripheral nerves. So the real important peripheral nerve that we're talking about here is going to be the vagus nerve, which is cranial nerve 10. And we have spoken about the vagus before. It's a big parasympathetic nerve. It's going to be innervating most of my visceral organs, certainly all of my visceral organs in my thoracic cavity, and most of the visceral organs in my abdomen. It is going to be, again, talking to my liver, stomach, small bowel, and then we'll be servicing the ascending colon here, and then the transverse colon here. Now, the descending colon, that is going to be picked up by the nerves of the parasympathetics associated with the sacral cord. But needless to say, the vast majority of the abdomen is serviced by the vagus nerve. The vagus nerve is both a motor parasympathetic, but it's also a sensory. In fact, if you were to transect a vagus nerve and give an account for the types of fibers that are in that vagus nerve, most of the axons traveling in the vagus nerve are actually afferents or sensory nerves. So their job is to communicate what's going on in the body back to the central nervous system, and the specific location is going to be in the brain stem. So I'm going to focus in on the sensory part of the vagus nerve, and if we're talking sensory, that means we have to have a sensory ganglia. And so I'm just going to cartoon this out for you, and I'm going to draw a pseudo-unipolar neuron there, and it is going to be leading to communicating with the brainstem. The more specifics on that we will talk about in subsequent lectures. So this sensory neuron here, and that neuron is part of the ganglia. The ganglia has a name. It is the inferior ganglia of the vagus nerve. You may recall you have two sensory ganglia associated with the vagus nerve, the superior ganglia and the inferior ganglia. And what I'm telling you is, when it comes to visceral organs of the body cavity, it is the inferior ganglia is the one that we're going to be concerned about. So these neurons here, again, they go many places. So they're going to be servicing the esophagus, servicing stomach, servicing heart. Okay, just the connective tissue around here, and then it's going to be liver, stomach here, esophagus, gallbladder, pancreas, colon, small bowel or small intestine, and such. So you get the idea. So all of these little sensory endings, they're communicating what is going on in the body back to the brain stem. Now, when I say that the vagus nerve is sensory, it is, but it's a special kind of sensory. All of the sensory information here is below the level of consciousness. In other words, you're not aware of the sensory information. So the receptors that are sending signals back to the brainstem, you're going to have chemoreceptors and you're going to have mechanoreceptors. So the chemoreceptors They're going to be handling or sensing chemical changes in your viscera, and then mechanoreceptors. They're going to be sensitive to physical manipulation of the endings in the visceral organ. Again, all of this is below the level of consciousness, but both of those are very important information that has to be communicated back to the brainstem normally anyway. So since we're talking, though, about emesis and nausea, then I'm going to focus on terms of the function here. So what's happening here, again, let's just take a hypothetical that you have some type of irritant in your stomach. Maybe it was, a bad piece of meat or something, or bad sushi, whatever. So you got something irritating your stomach, and now you're becoming nauseated and perhaps eventually vomit. So what's going on in the stomach? Well, what's going on is that the stomach is going to be increasing a molecule called serotonin. And the scientific name for serotonin is going to be abbreviated 5-HT, and this is serotonin. So I actually will have cells in the stomach that will increase its level of serotonin in response to an irritation. And one of the major cells that's thought to do that is called the enterochromaffin cells. They will release serotonin, and then the serotonin is going to bind to little receptors at the end here, and these receptors are serotonin receptors, and they're a very special type of serotonin receptors, and we're going to call these 5-HT subtype 3 serotonin receptors. So the serotonin will bind to the 5-HT subtype 3, and when they do that, it starts to send signals back up through the vagus, back, all the way to the brainstem, stimulating the vomit center and stimulating nausea. So this information gets communicated to the brainstem. So that's just an example of how the vagus nerve is going to stimulate emesis and nausea, because it is reading what is going on in the body, and then again possibly doing that. And so the major player when it comes to vagal stimulation for emesis and nausea seems to be serotonin, and interacting the serotonin with that serotonin subtype 3 receptor. One of the other interesting things, though, since the vagus nerve doesn't just innervate, just the GI tract, if I have some type of irritation in the pancreas or the liver or the gallbladder, again, a similar thing can happen. That there's something happening on the chemical end, probably involving serotonin, that will again communicate that signal back to the brainstem via the vagus nerve to become nauseous and to perhaps vomit. One of the interesting things, too, is that it also innervates lung and heart. And one of the things that is kind of interesting about that is that a heart attack can also cause vomiting. So, again, the mechanism is not clearly worked out, but if a patient is having a myocardial infarction, which means literally part of the heart is undergoing or is dying, infarct means to die, and usually that's an in process of a lack of blood flow to heart tissue. So if you cut off the blood flow to heart tissue, maybe you have an occlusion of a coronary artery. Now you're creating ischemic conditions, you're depriving it of oxygen and other nutrients, then the tissue literally begins to die, and that's called a myocardial infarction or an MI. So what is known to happen is that if the myocardial infarction is extensive enough, it ends up releasing some chemicals, and again, still not quite worked out, but it ends up stimulating the vagus nerve going to the brainstem and actually will cause the patient to vomit. Interesting data on this in that there is a correlation, because not everybody that has an MI vomits, but there is a correlation with the probability of vomiting as a part of presentation of a myocardial infarction and the severity of the infarct. So the correlation is the larger the infarct, the more likelihood the patient is going to vomit. So again, if somebody's having a heart attack, they're having an MI, and they vomit, that's not really a great sign. So again, the general point here is that as far as monitoring peripheral types of things in your body, the vagus nerve is a major player relative to emesis and nausea. Lots of things, again, can set this system off. Bad sushi, of course, but any toxin or a pathogen that comes in, your GI tract is going to relax, is going to react to it. Inflammation could cause this process. You have an inflamed one of these organs that could end up leading to nausea and vomiting. The vagus nerve also innervates coverings of the abdomen, so it's going to be innervating your peritoneum. In your peritoneum, when it becomes inflamed, now you have peritonitis, very painful, but also the vagus nerve is going to pick up on that, and that could lead to nausea and vomiting as well. Radiation. People who are struggling with cancer, many times they have to undergo radiation to push back on the cancer or shrink a tumor, whatever else. Again, the mechanism is not clearly worked out, but the radiation is irritating the GI tract and other organs that are innervated by the vagus nerve. And again, the vagus nerve is stimulated, talks to the brainstem, and now you have emesis and nausea. I want to talk about another set of peripheral nerves. And this is going to be different because, as I said, the vagus nerve, all of this is below the level of consciousness in terms of it monitoring things in your visceral organs. But you also have conscious awareness of your organs as well. You know what a bellyache is. You know when your side hurts or something like that. So we do have other neurons, and these are going to be associated in talking to the spinal cord. And say, for instance, I'm going to have, again, a DRG, a dorsal root ganglia, okay? And it is going to be communicating to the spinal cord. It will talk to a neuron there, and then another neuron there will ascend up and then talk to the brainstem. So if I'm talking about the area below the diaphragm, which is where my GI is, I'm going to have some special nerves. They're going to be innervating these organs here. And these nerves are called splanchnic nerves. And these splanchnic nerves are carrying conscious sensation. And so they could be stimulated, and it gets talked to, in terms of the neuron here, and again gets communicated to the brainstem. Now, the reason I'm talking about this is because I want to address the issue of pain. These nerves can be involved in pain sensation of the abdomen. And so what happens is if you have an irritant, again, any type of nociceptive stimulation, nociception is, of course, a medical term for pain, it's going to stimulate these neurons to release substance P. I'm just going to say, right here, substance P will be released onto these neurons there and stimulate these neurons to go up to the brain center, and you're going to have the subjective experience of pain. The sensory neurons above the diaphragm, we don't call those splanchnic nerves, and so I'm just going to draw this in here because you certainly have innervation of all these places, your lungs, your heart, and such. Okay, and they're going to turn around and they're going to do the same thing, talk to neurons in the spinal cord, and it will also send signals up. And so if I have pain associated with heart or pain associated with lungs, again, same story, substance P. The reason I bring this up is because we know that pain can also cause vomiting and nausea, severe pain. I'm not saying all pain causes it, but I am saying some pain causes it. So nausea, vomiting associated with pain is not that uncommon. Now, unlike the vagus story that I just told you, which is a lot of work's been done on that and the mechanisms are becoming clearer, pretty well worked out, how pain generates nausea and vomiting is, shall we say, ambiguous. We're just not sure what the mechanisms are. So we know that it can happen. So we know these signals are coming up the cord. How they interact with the brainstem to effect nausea and emesis, again, is unknown, but we know that there is some pathway involved. So all I'm going to say here is this is DRG here, dorsal root ganglia. Here's a dorsal root ganglia here. So all I'm going to say is that these neurons here may be involved some way, somehow, but it's not clear. So my take-home point with this in terms of periphery and nerves is the vagus is the big player, and that it may be that some of these other nerves, splashing nerves or other sensory nerves, may also be a player, but those, if they are at all, perhaps are involved in pain in terms of pain affecting emesis and nausea. Again, the mechanism there is just simply not worked out well at all. Kind of going back to the heart thing, in terms of the vagus, when somebody has an MI and they vomit, the medical term for that would be cardiogenic emesis. And again, the name tells you what it is, genesis beginning, so the vomit event or the emesis event or the emetic event is caused by the heart. Okay, so that's peripheral nerves. The next thing I want to talk about now is going to be how molecules in the blood can also stimulate the vomit center and nausea. So what we have here is blood vessels that are coming and associated with the brainstem itself, and I'm going to get into more detail on this in a coming lecture. But any type of toxin, any type of molecule out there that could cause an ill effect on the body could be in the bloodstream, and so the blood will actually be carried to the brainstem and allowed to interact with certain neurons in the brainstem, and if the neuron sees those molecules, it can affect nausea and vomiting. The two big major players in the blood that can do that is going to be serotonin, which we know is 5-HT, and substance P. So I had mentioned earlier that substance P is associated with pain processing in the central nervous system, but substance P does a lot of other things. There are many places in your body that make substance P. So, and it could be that this, again, in response to some type of irritant, maybe it's involved in pain, I don't know, but something in the body is having cells will generate substance P. It goes into the blood because what is clear in terms of research, if you take an animal and infuse their blood with substance P, if the animal can vomit, they are going to vomit. So substance P can be a powerful emetic. So substance P is a player, and again, it's not worked out, but a lot of processes can raise the level of substance P in the blood. And it's been known individuals, again, post-surgery, they're in a lot of pain. They will assay their blood for substance P, and the substance P goes up. And so, again, this also may be a mechanism to generate emesis and nausea. And the other one, of course, is serotonin. And so not only as the cells in here respond to an irritant by releasing serotonin that stimulates the vagus nerve, that serotonin can also get into the blood and can talk directly to the brainstem via blood flow as well. So those are the biggies. Of course, other things that could be working in this process here would be certain drugs or toxins. We know that certain drugs causes you to vomit, causes you to become nauseated. We'll talk about this a little bit later, but opioids, that's a common side effect of opioids, is they make you nauseated and they make you vomit. Again, lots of drugs can do that. But the mechanism, pathway there is thought to be blood-borne. The last thing that I want to talk about is going to be brainstem and brain. So let's go ahead, we'll change colors here. And so I'm just going to draw a side view of a brain. So there's a brain there, side view. And I'm just going to represent one neuron is going to come down and it's going to talk to the brain stem. There are ways to become nauseous and vomit that has nothing to do with my peripheral system, has nothing to do with my body. It's just something in the brain that is causing this. One easy example would be that if you smell something very foul, it's intensely fetid. I don't think you have to stretch your imagination of smelling something so bad that it makes you vomit. Well, how did that happen? What's happening is sensory information coming into the brain processes it, goes down to the brain center and says, this smells bad, vomit. And then you vomit. So the brain itself can cause vomiting. So let's talk about a few other things. Okay, we'll go in the category of brain here. So I just go over here. So I got brain. Any type of meningeal irritation can cause emesis or vomiting. Meningeal irritation. And we know meninges is the covering of the brain. When somebody has meningitis, that's just an inflammation of the covering around the brain and the spinal cord. So that can cause, again, through the brain, causes emesis and nausea. Strokes can cause it. So if you have an ischemic event, whether it's hemorrhagic, you have a bleed in the brain, or it's embolotic, you have a clot, again, one of the signs of a stroke could be, again, vomiting. Now, this is interesting in the sense it's sort of like what we talked about with cardiogenic emesis. Some people have strokes, they don't vomit. Other people have strokes, they vomit. There is a statistical correlation to the fact that if the patient has a stroke and they vomit, that the outcome for that patient is a lot worse than if a patient has a stroke and they don't vomit. So the emesis result of a stroke tends to be tied in with the severity of the stroke. Another thing that could cause emesis is going to be an elevation in intracranial pressure. So we all know that inside the cranial vault, there's just not a whole lot of room. If the brain swells, again, just not a whole lot of room for the brain to expand, so the pressure goes up. Lots of things can cause intracranial pressure. It could be inflammation of the brain could cause that. Traumatic brain injury could cause that. Bleeds. If you have a hematoma developing in the brain, it could cause that as well, particularly if the bleed is arterial in nature. You have a lot of pressure coming in there. Lots of ways of increasing intracranial pressure, but intracranial pressure can lead to nausea and vomiting. Another thing also, and this has to do with your emotions, and we know that the part of the brain that is processing emotions is called our limbic system. That's the emotional brain. So we can become nauseous and we can vomit having to do with very unpleasant emotions. So it may be that we see something that is offensive, so disturbing, response is vomiting. Or we hear something so revolting, the response is vomiting. So our emotions can cause vomiting. Anxiety can cause vomiting. So the process there by which how all of that works out, we don't understand. But the point being, higher brain centers can cause emesis. An interesting example of this would be anticipatory nausea in emesis. If you have some type of negative thing where you become to associate a very negative experience with vomiting and nausea, that can be reinforced. Think back like Pavlovian dog, ring the bell, salivation. You're all familiar with that classic experiment, Pavlov. Same thing can happen with nausea, where you can associate one event that's so negative that it causes you to become nauseous, and the fact of even thinking about it or being in an environment that reminds you of something very traumatic, that can cause nausea and vomiting. So there is a strong emotional component as well to vomiting. And one of the things we're going to talk about a little later is going to be chemotherapy patients and them becoming associating vomiting with the actual therapy itself. As again, we'll talk about later, chemotherapy agents can be very powerful emetics. And so when a cancer patient goes in and they're having their chemotherapy, in response to the chemotherapy, they become very nauseated and will vomit. But when they go through a couple associations with that, then what they'll start to develop is called anticipatory emesis and nausea. And what that means is that even if they go to the clinic before they actually get the chemotherapy, they become ill and vomit, and they haven't gotten the drug yet. That's purely emotional, but that is also a conditioning type of thing. And again, so it's called anticipatory emesis and nausea relative to chemotherapy. It's a real tough one. So the point being, though, is that you can have certain emotions that associates something with something that could trigger that type of event. Okay, so again, what I've done here is I've just kind of done a whirlwind tour of the nervous system in terms of how the nervous system can communicate in response to something in the body, the peripheral nervous system, something in the body that is going to be causing emesis or nausea. We also then talked about things in the plasma, in the blood, can cause emesis and nausea. And again, it's picking up some type of molecule in the body it doesn't like, talks to the brainstem, and then you have a vomit reflex. And then lastly, you can have higher centers of your brain as well, processing information in the environment, and maybe it's something upsetting, maybe it's something you don't like, and you end up getting nauseated and you vomit in response to that. So that's my first part of dealing with the neurobiology of emesis and nausea.